Welcome, everyone. Thank you for joining us on the last day of Sarcoidosis Awareness Month. It's great to see so many of you. We hope you're as excited as we are. This year, FSR's Awareness Month theme is Say Sarcoidosis, and many of our events and activities have focused on empowering each other to own the disease and to say the word sarcoidosis through education, storytelling, and awareness efforts. In this evening's webinar, we look to provide you with an overview and introduction to legislative and policy advocacy and explore FSR's efforts to advocate for those affected by sarcoidosis. Additionally, we'll share some tools and programs to get you started. I'm Mia Cotto, FSR's Senior Patient Outreach Coordinator and the moderator for this session. Before we start, I want to go over a few housekeeping items. This session is being recorded. After our speakers finish their presentations, you'll have an opportunity to ask questions. When asking questions, please use the chat feature. We will do our best to get as many questions answered as possible. Please note that FSR is a nonpartisan, nonprofit organization. Our goal is for all legislators and regulators to understand the impact of sarcoidosis. We do not endorse nor oppose any political party, ideology, or candidate. We appreciate your feedback and use it to shape our educational programming. After this webinar ends, please fill out our short survey. You should be automatically prompted to complete the survey after the webinar closes. Finally, we'd like to thank our sponsors for making this event possible: ANI Pharmaceuticals, Kinevant Sciences, Inc., and Mallinckrodt Pharmaceuticals. I'm now honored to introduce our speakers. Please join me in giving them a warm welcome. Tricia Shivas, FSR's Chief of Staff and Strategy; Caitlin Laws, EveryLife Foundation for Rare Diseases Associate Director of Rare Disease Legislative Advocates; and Mary McGowan, FSR CEO. Welcome, Tricia, Caitlin, and Mary. Thank you for being here. Tricia, I'll now pass it over to you.
Thank you so much, and I'm going to share my slides. And here we go. So thank you everybody for joining. We're really excited to have a conversation about how to use your voice to catalyze change. And I just want to quickly start with a conversation about the difference between lobbying and advocacy. So advocacy is a broad promotion of an idea or a cause, and it's helping to shape policy through organized intervention. Lobbying is a specific form of advocacy where you're looking to get an elected official to take a particular position or vote in a very particular way. And this can be part of an advocacy campaign, but it is unique. And so when we talk about advocacy here, legislative advocacy, we really want to focus on the first version. We're not looking to lobby on any particular legislation. As a 501c3, a nonprofit 501c3, we don't lobby. We do share stories to help people better understand policy ideas that need change. Here is the list of FSR's legislative or advocacy policies, priorities. So we have the first one, which is better access to care and letting doctors decide what treatments people should be able to take. We want to make sure that we're ensuring fair drug pricing, more funding for research, specifically sarcoidosis research, improved clinical and drug development clinical trials, and equitable access to care. And this is just a little bit about what FSR is doing with regard to our legislative activities. And then I'll move over after this conversation to how you can get involved. So a little bit about what FSR is currently doing. We are building relationships, and this is a key part and something when we talk about what you need to do or what you can do, this is a key thing to focus on. Building relationships is the most important part about advocacy. So we build relationships with clinicians, researchers, industry, legislators, and others in order to make sure that they understand the needs of the sarcoidosis community and they understand what those challenges are that people are facing with regard to access to care. We participate in coalitions, which are large groups of or organizations that are bringing groups of people together who have like-minded ideas in helping to drive pieces forward. We participate in sign-on letters, which are letters that are specifically focused on a topic area to say this is something that the sarcoidosis community cares about. And this allows us to leverage our collective voices together in order to show that there's a lot of different groups that care about a particular issue. We participate in congressional briefings, letters to governmental departments, Hill days, and engage with different international agencies and national agencies that are regulators as well. So a little bit about the coalition work that I talked about. So our coalitions, again, are groups of different organizations that all believe or have the same needs. And so one of the things that we're doing when we're working on these coalitions is we're identifying issues that are most important to our patients and getting our voice out there. We help to draft legislative priorities that can make it clear what are those priorities for different groups. One example that I have here that you can see some of the photos from is the Coalition for Skin Diseases. Many people living with sarcoidosis have skin diseases, and so we align with many of the issues that other skin diseases do as well. We draft letters to Congress, to the FDA, the Food and Drug Administration, the NIH, the National Institutes for Health, and other governmental agencies to let them know what our priorities are and the priorities of our community. We create awareness campaigns. We provide testimonials at hearings on Capitol Hill, create blogs and informational events, and we participate in Hill Days, where we are visiting, and you'll hear more about Hill Days from Caitlin, but where we are visiting with our senators or our legislators and Congress folks to help them understand what the needs are and helping them understand how they can create legislation that meets those needs. We're also very proud to partner with the RDLA and the EveryLife Foundation in the work that they are doing on Rare Disease Week on Capitol Hill. This past year, there was over 800 participants at Rare Disease Week on Capitol Hill, and one of our advocates, Marcia, who you see here in the photo with me, was able to speak to that full room of 800 individuals on the importance of interagency communication across all those different groups that I had mentioned before, in order to drive the policies that are most meaningful to patients. We've also opened an office in Washington, D.C., in the EveryLife Rare Hub. I'm going to play a quick video for you about which will show you our congressional briefing that we held last May to really focus on clinical trial diversity.
Hey Trisha, I'm just gonna jump in real quick. Sound's not coming through, so maybe we could restart the video. That'd be great. Thank you.
Oh, best laid plans, everybody. We tested this before, but it did not work out, so we'll try again. So hang tight with me while I get this started. Um, hmm, 1 second here. I do not have the option for sharing the video. Let me try again here. Let's see if it will go directly to that. Um,
Unfortunately, still no sound, Trisha. So, yep. All right. Well, I will drop it in the link for everyone to watch it afterwards. But yeah, perfect.
Sorry, everyone. I don't know where that had stopped. We were working fine, but unfortunately, the sound has not worked out. But you can find the link in the chat, and you can go and visit that yourself and learn more about that work. So in the meantime, I'll pop up our next slide. So this was a focus on clinical trial diversity and making sure we were able to address the challenges of clinical trial diversity. And so just a couple of learnings that we had out of that we had individuals that want to participate in clinical trials, but are often not asked, that they are not getting access through travel or for compensation that makes it possible for them to participate in trials. And there was a lot of financial barriers. And so we created a number of different asks that we focused on there, which included more funding for sarcoidosis research through the NIH, which is the largest funder of research. And then clarifying the Family Medical Leave Act, which currently does not cover clinical trials. And so we sent a letter to the Department of Labor and we asked for a clarification to make sure that the Family Medical Leave Act, which is the framework that helps shape all employee compensation, employee access to time off, does indeed make it possible for people to participate in clinical trials. And then finally, we asked for a tax credit for all of those that are participating in clinical trials. And a tax credit is, if you remember from 2020, is when you can get a little bit of money for something. In the past, in the 2020 time period, people were getting a tax credit for children, for having children, that was helping to deal with some of the challenges that had come out of COVID. This would be a tax credit for those that are giving of themselves in order to participate in clinical trials to advance science for all of us. We also work really closely with the FDA. And through that, with a patient listening session that we held back in 2022, we were able to meet with a very large number of FDA members, 50 members from 16 different offices that engaged deeply with us. And this is an opportunity for us to share with them our challenges and the needs that we have to help them better understand the disease. And so while we're trying to find new therapies that everyone needs, those conversations have to happen with the FDA because they're the ones that make the final decision as to whether a drug is approved or not approved. With that in mind, I'm very excited to share with you that we have our next step in that conversation with the FDA, which is an externally led patient-focused drug development meeting. And the purpose of this meeting is really to dig in around the drug development process. So this is where we can explain what those barriers are to make it possible for people to participate in clinical trials. We know many people in the community have had some concerns about being able to participate in a clinical trial because they're not eligible. Those eligibility criteria are defined by different pieces that the FDA puts in place. And then also trying to make sure we have good representation in our clinical trials and inform them of the challenges and barriers that current therapies have. So many people will speak about how much they hate steroids and how steroids are very challenging for them. Well, this is an important thing for FDA to know because though there is a therapy that is available that has been FDA approved, that therapy has so many challenges that can be very impactful on people that we need to share that we need alternatives as well as we're thinking about that. We're also really proud as at the FSR of the work that we did to help advocate for the PACT Act, which was passed in December of 2022. And the PACT Act is a law that expands veteran healthcare and benefits. Veterans exposed to burn pits, Agent Orange, and other toxins have access now to specific disability access as a result of being survivors of that. And so their survivors also can be earning those benefits. There's a whole process for that, and we'll jump into the chat information on how, if you are a veteran, you can learn more. But this is a presumed, because of your work as a veteran in these areas, you now have a presumed disability, which means that this gives you access to a lot more support from the VA as a result of this. And we're really proud of the work that we did to make this possible. So I want to just shift a little bit here now away from the things that FSR has been doing on your behalf and really invite you to be a part of this process. So we ask you to share your story and why it's important to advocate. Your stories matter the most. We were just talking about this before we got on the call here today about how impactful and how moved your representatives are when you share your story and help them understand what exactly it is to live with sarcoidosis. And so we know that those stories are the most impactful way. We can do this as an organization and share all those different pieces, but when they hear from you and they hear those challenges and they hear those pieces that are barriers to you being able to live a meaningful life, that helps them think about how they can focus their energies in creating legislation that is responsive to that. So your voice is needed. All politics is personal. Legislators serve their constituents, and that may be you. So you're going to want to talk to the legislators that are in your area and they respond best to the people they know. So this goes back to what I started the conversation off with, which is it's really important to build relationships. You don't want to have just one conversation with a legislator, but you want to have repeated conversations with them so that they know who you are. And when they're thinking about budgets or legislation that they might consider, they're thinking about you and what would be most beneficial to you. So they vote on what they care about, what they know, how long that impact will be, and what the cost might be. So there's a couple current legislations to be aware of. And so I'll very quickly run through these because I want to give enough time for questions at the end. But it's important to understand the appropriations. So you probably heard that word a lot, appropriations, and this is why we almost go into government shutdowns. But what that basically is how the budget is filtered out and what is getting funding and what is not getting funding. And so we want to make sure that we follow to make sure that there is not a significant decrease for the NIH, but we're looking for increases for the NIH. And so we've had over the years a sort of consistent flat level. But if you think about the fact that that flat level is not bringing in any of the current changes in our own economy, that is a decrease for the FDA. And we want to make sure we're increasing that for them. We also want to talk about the Safe Step Act and the Help Co-Pays Act, and I will talk about those just here quickly. Very quickly, the NIH is a very large group of multiple institutes that are coming together to advance research and understanding of diseases. And you can see all those different groups that are coming together here. And so we advocate, along with others through coalitions, for an increase in funding to at least 51.3 billion, so it can feed all those different institutes, helping to provide research for all the different diseases that you can think of through this pathway. The Safe Step Act is an act that is currently both in the Senate and in the House. And the goal is to try to eliminate when you go to the doctor and they want to prescribe something for you, and your insurance company says, well, you got to try this drug first and show that it doesn't work. The reason it's important to advocate against this from our standpoint is that 6-month period that you have to wait to prove that that drug doesn't work is really very hard on your body and will take you from someone that is at a stage where they should be all the way up to a very challenged or tired stage. And so we want to make sure that you're getting the drugs that your doctors prescribe. The Help Co-Pays Act is a ban on something where if individuals need coupons in order to get access to their drugs, and that is one of the ways that they can help pay for that. Right now, that money is going back to the pharmacy benefit managers, which is an intermediary between insurance companies and the patients, which is completely unregulated at this point, and the insurance companies themselves. And so we want to advocate for this so that the money can go back to the patients against their deductibles in the ways that will help them benefit as it was initially intended by these opportunities. Before I pass it over to Caitlin, just a few other quick opportunities here for ways that you can get involved. Write letters, share your story, inform your legislators of what they need to know about what are your challenges. Get involved with phone calls. I know that's one of the most intimidating things nowadays. We are all text people and we don't pick up the phone as much. But I'll tell you, if you want to have the most impact, picking up the phone to your legislator is a big way to have an impact because they actually have to log every single call. So when you're calling and noting that, they're logging that information and they're saying this is something that's a priority to our constituent. Getting involved in social media, respectfully tagging your social media on things that are important to you and that may impact your health and life. Meeting face to face or virtually. Now there's a lot of virtual meetings taking place, and I'm sure Caitlin will be sharing more about that as well. And participate in live meetings like our Hill Days or convenings or other meetings that we have. With that, I'm going to stop and I'm going to allow Mia to introduce Caitlin.
Thanks, Trisha. That was a great presentation. Caitlin, I'll pass it over to you. Caitlin, you're on mute.
Thank you so much. Sorry, it is the very end of the day, as you can see. I'm going to pull my slides up here. Awesome. I'm so happy to be here with you guys. Thank you for having me. My name is Caitlin Laws, and I am the Associate Director of RDLA, which is a program of the EveryLife Foundation. So if you have not heard of us, the EveryLife Foundation for Rare Diseases is a 501c3 nonprofit, nonpartisan organization. We are dedicated to empowering the rare disease patient community to advocate for impactful, science-driven legislation and policy. And we teach advocates about legislation and policy that advances the equitable development of and access to life-saving diagnosis, treatments, and cures. And one important thing to note is that we do not speak for patients. We provide patients training, education, resources, and opportunities to make their voices heard. And by activating the patient advocate, we can change public policy and save lives. So a little bit about RDLA, or Rare Disease Legislative Advocates. RDLA serves as a clearinghouse and advocacy center for the rare disease community. So we do not serve only one rare disease, but rather we are an umbrella organization serving the entire community. We provide resources and tools for individual advocates as well as other patient advocacy organizations. All events and resources that we host or create are free and available again to the entire rare disease community. And RDLA is essentially the advocacy arm of the EveryLife Foundation. Our goal is to educate patient advocates about how legislation and policy impact the availability and access to treatments, and then provide advocates with resources to go out and make a difference. It's really our goal to build awareness on Capitol Hill and ensure that Congress hears directly from rare disease patients and caregivers. And of course, one of our goals is to connect every member of Congress with a rare disease advocate, patient, or caregiver, so that when they are considering legislation that impacts the rare disease community, it's not just about voting on that bill, or it's not just about treating a disease that they maybe haven't heard of. It's about saving a person that they know. So like Trisha spoke about earlier, there is real power in grassroots advocacy. Legislation and public policy on both the federal and state level impact science, the drug development process, and access to treatments. And you as a patient or as a caregiver have the power to affect or impact change. You can do this by taking an active role in the political process. This means showing up to town halls, staying in contact with your members of Congress, either through virtual meetings, letters, phone calls, and voting, of course. And again, you have the power to influence legislation and policy. This is something that Trisha spoke a little bit about earlier, but when it comes to meeting with your members of Congress, RDLA provides resources and opportunities for you to do so. Everyone that lives in the U.S. has a member in the House of Representatives who represents the district that they live in within their state. And then everyone also has 2 senators that represent their state, with the exclusion of Puerto Rico and D.C. So your 1 representative and your 2 senators have the job of serving you and your interest. And meeting with your members, whether in person or virtual, has proven to be the best way to bring issues to their attention and to really influence their decisions. So when you schedule a meeting with a member of Congress, you're likely going to meet with their staffer instead of the actual member themselves. But it's really important to note that the staffer that you would be meeting with handles the member's health policy portfolio. So members will have staff that work for them that handle different types of policies. So the person that handles their health policy portfolio is really the healthcare policy expert in their office. And building a relationship with that staff member is key to impacting change. And if you're wondering what it's like to meet with your members of Congress, this is where we come in. We help by offering trainings and tips on how to make your meetings go smoothly and how to have a worthwhile meeting. We have a mock meeting video on our website that is meant to show you exactly what these meetings look like. So if you haven't met with your members of Congress before and this is something you're interested in, I encourage you to check this video out just to get a visual of what these meetings are like. And if you're wondering how to meet with your members of Congress and how to get involved, again, this is where we come in. So I'm going to talk about this a little bit on this slide. So this slide has all of RDLA's different programs or opportunities for involvement. So I'm going to start with the first and go through each of them. Our first program is our monthly webinars. So like the title says, we have webinars each month. Each one focuses on a different topic, and we invite experts on that topic in to provide presentations to advocates on whatever is timely in the rare disease space. Most of these webinars are going to focus on federal policy issues and federal advocacy opportunities. So highly encourage attendance there. And then Rare Disease Week on Capitol Hill is probably our biggest and most attended event or program. Rare Disease Week on Capitol Hill is an event like no other, truly. You spend the entire week learning about federal policies impacting the rare disease community and taking a real deep dive on these federal policies, learning how to speak about them candidly. We also host a caucus briefing, a documentary screening, a rare artist reception. So all kinds of events go into this week. And then once you've spent the whole week learning and networking with other rare disease advocates, you spend one day meeting with your members of Congress. And the whole point of having the week before is to build rapport within your groups. Meetings are taken by state. So for example, I'm from North Carolina, so I will meet with the North Carolina group during our day of legislative conference, where we take a deep dive on the policy issues. And we sit down and decide, okay, who wants to share their story? Who has a story that ties into this bill we're going to be asking them to support? And build an agenda so that when you go into these meetings, you're prepared, you know what to expect. And that's just an event that I recommend to everyone, no matter if you've participated in a Hill Day before or not. We also host trainings prior to Rare Disease Week for those who are attending for the first time. So we make sure that you have ample information and prep going in. And that always takes place the last week of February. The next event is Rare Across America, and this one is actually coming up with registration opening in 2 weeks. Rare Across America is an opportunity for you to meet with your members of Congress close to home without having to come to DC. You meet with your representatives at their in-state, in-district office, and then you meet with your senators virtually. So you're only having one in-person meeting, or if you only want virtual meetings, you can choose to only meet with your senators. And like Rare Disease Week, we provide training prior to Rare Across America to make sure that you're ready to go for these meetings. You understand how to share your experience with rare disease. And again, we take deep dives into each of the policies that you would be speaking to your members about. The next program here is the Rare Disease Congressional Caucus. So we work very closely with the caucus to host 4 caucus briefings a year. Our next one is going to be coming up in May. It's going to be held in person, but we'll have the option to view virtually from home as well. So keep an eye out there. Our next program is our Youth and Teen Advocacy Day. Registration for this event is now open, and this is an event for young adults and teens ages 10 to 18. And it's a lot like Rare Disease Week and Rare Across America, where we're prepping you, and then you go and meet with your members of Congress one day. Those meetings are virtual, so again, this does not require any travel. And it's a really great chance for young adults and teens to come together, learn about issues impacting young rare disease patients, pediatric rare disease patients, and then going to their members and asking for their support as a pediatric rare disease patient themselves. Our next program is Rare Advocacy Learning. And this program is currently taking place right now. We host it each spring. It's a 6-week seminar, and it is free to those who attend. We do open up an application process for folks to apply. We accept 50 students into the seminar, and each one has a different topic. The purpose of this program is to really provide a learning opportunity to advocates who have maybe done all the rare disease weeks and all the rare across Americas, and now they're looking for something else. So that's where rare advocacy learning comes in. Just to give you a quick example, the seminar right now is focused on patient-focused drug and product development. So next spring, we'll have a different topic for that seminar series, so keep an eye out for that. Our next program is YAR, or Young Adult Rare Representatives, and this is a group of really highly motivated young adults, ages 18 to 31, and there's ample opportunities within the YAR program to grow your advocacy skills, to grow your professional skills, and to network with other young adults in the rare disease space. So I could not encourage that program enough for folks who do fit into that 18 to 31 age range. The next program is Rare Giving, and this is probably geared a bit more toward organizations than individuals themselves, but Rare Giving provides sponsorships for other rare disease nonprofits. We provide 2 different sponsorship opportunities. One is for events and one is for tools and resources. So any of those of you who are watching with an organization, highly encourage you to check that out for some funding opportunities. And then last but certainly not least, we have the Rare Voice Awards, which is our award ceremony at the end of the year, where we come together and really celebrate the rare disease community and the accomplishments of that year. Aside from all those programs, we also have resources for you, including a monthly newsletter with current federal policy updates, state policy updates, free resources, and free events. So this is really a one-stop shop to find out exactly what's going on within the rare disease community and how to plug in to get involved. Like I said before, we have our webinars, caucus briefings. On our website, we also have action alerts you can go to, and these are issue-based. So, you can, if you see one that really speaks to you, you can click on it, and there's a pre-written message that you can send to your members of Congress. So that's a really easy and quick way to take action. We also have our legislative scorecards, and these serve the purpose of giving you a quick snapshot of how your member has supported federal policy that impacts the rare disease community over the past year. So prior to any Hill days, I encourage you to check that legislative scorecard out just to see what your members done in the past year and what more you could ask them to do. We also have tip sheets on various topics. We have tip sheets on how to build a relationship with your member of Congress, a tip sheet on how to write a policy primer. So lots there. And then, of course, we have policy primers on other federal legislation impacting the community as well. And all of these resources can be found at rareadvocates.org. I encourage you to keep in touch with us. You can sign up for the newsletter I just mentioned, check out the action alerts and events that we have going on at rareadvocates.org. I also encourage you to follow us on social media. We are active on Facebook, Twitter, Instagram, and LinkedIn. So that's a great way to keep up with all of the things that we have going on. And then, of course, if you have any questions related to RDLA, you are welcome to reach out to me. My email is listed here, klaws@everylifefoundation.org. And if you have any questions specific to YAR, my colleague who leads the YAR program, her name is Courtney Felly, contact information there. And then if you are more interested in learning about state advocacy, our state advocacy manager is Kinley Jones, and her contact information is listed for you there as well. Thank you guys for having me.
Great. Thank you so much, Caitlin, for your presentation, and Trisha as well. I learned so much, and it looks like our audience do. So we already have some questions for you. To start off, getting started with advocacy can be a little bit intimidating, especially for people who don't have a lot of experience. So how do you recommend that sarcoidosis patients can get started?
Yeah, I'll jump in first, and then Caitlin would love to hear additional thoughts. So the first thing that I would recommend to everybody, and I think this was in the chat, but we can drop it in again, is our FSR Policy and Advocacy Toolkit. This does lay out for you and really put at your fingertips ways for you to have conversations, how to find your legislators, draft emails, draft scripts if you're going to pick up the phone and call about something. So it really tries to make it very easy for you in a turnkey way. I would also highly recommend the opportunity to participate with our partners in their trainings, like Caitlin was describing. That gives you a chance to get a little bit of confidence in your voice. Your story is already impactful. You don't have to worry about that. I think what often gets in the way of people feeling like they can get started is the fear. And so everything that we have here is really to help you so that you feel confident enough to be able to move in that direction. But Caitlin, I'll pass it to you.
Yeah, I think that's a great answer. The toolkit sounds like a phenomenal resource for those who are getting started. Um, I see folks who have never attended Hill Days or participated in advocacy before who just hop right in and come straight to Rare Disease Week, and they love it. And, some folks like to prep a little more, and that's okay too. And that's what all the resources and webinars and toolkits are for, to help you kind of get some grounding. And then you can come into these events and attend the trainings beforehand. That's something I highly encourage. Like I said, for Rare Disease Week and Rare Across America, we host trainings on how to share your story, as well as general trainings that just cover what to expect. So when you are participating in events, I think it's important to know that the organizations you're participating with are there to support you, to make sure you have the resources and the confidence that you need to participate. And it's also important to know that you're just meeting with other humans. The members of Congress you're meeting with, they are just other people just like you are. The staff is often really young and really knowledgeable. So just work on, building those relationships. And I really think that's the most important part.
Great, thank you. What really stood out to me about both of your presentations was about how much advocacy work is really about sharing your story, right? Because that really is the most powerful thing that you can do. We have a question. This is for either of you. How can people find out who their legislators are and keep track of legislation that, might apply to rare disease patients or sarcoidosis?
Caitlin, why don't you jump in this time
Yeah,
first?
I'll hop in here. I will share a link in the chat, unless there's already one there, on how to find your members of Congress. It's super easy. Type in your zip code, it'll pull it up for you. And in terms of staying up to date on different bills, I think signing up to receive newsletters, attending webinars, where you can hear about things that are timely and exactly what's going on, because there are so many bills. You could go on congress.gov and track them yourself if you're feeling brave, but I would attend webinars and read newsletters if I was getting started, for sure.
I agree with that. And I think, one of the things when you first get into legislation is there's a lot of acronyms. DC is the city of acronyms. So you'll hear people start throwing around all these different acronyms, and you're like, who is that? And what is that? And how does that work? And don't be intimidated by that. Or you'll hear, some of these terms like, the copay accumulator or the Safe Step Act. And you're like, well, I don't know what any of that means, right? Well, if that's where those webinars can really come in, because oftentimes, you do actually know what that means. You do have the experience. There's just, it's been DCized essentially, so that it's now something that all the DC folks can talk about in their DC language. But you definitely have those experiences. And so spending a little bit of time just getting familiar with how the representatives are talking about this is one of the key ways that you can really feel more comfortable in a meeting, because they may throw one of those terms back at you where you are like, I don't know what you mean by Safe Step Act, but you sure know what it means to have your insurance company stop you from getting access to the drug that your doctor thinks you need. And that is what the Safe Step Act is all about. So, learning a little bit of those terms by attending those webinars, and paying attention to the newsletters will really help you feel more comfortable in those meetings.
Great, thank you. And this question it can be for both of you, but I'll have you start, Tricia. What should patients do after they meet with their legislators?
Yeah, absolutely. So I think the most important thing is, it's not a one-time thing, right? I think I said that earlier, but I think when people make mistakes as far as advocacy go, they kind of pop in, they say hello, they tell their story once, and they never hear from you again. And that's not going to have the impact that you're hoping that it will. So it's really important, if you're having a meeting and you've already set up a meeting, to make sure you follow that meeting with emails that gives really specific guidance on what you're trying to talk about. So sharing your story, links to legislation that might be related to your story, which you can often get from, folks like us, or folks at EveryLife or others that can kind of give you a little bit of a tip on that, so they can read up more, understanding what is happening there. But also, it's consistently following up. It's building that relationship so that when you show up to your legislator's office, they already know you. And they're ready to have that conversation. I can share a story briefly here with one of our advocates who has built that kind of relationship with her legislator. And when she went and was leading a meeting that others were bringing during Rare Disease Week, they had a 45-minute conversation with the legislator, because they knew her name, and she was a familiar face, right? Those kinds of things can really take you very far. So just consistently follow up, check in, tell a little something about your story. Writing Christmas cards or holiday cards can go a really long way to making it feel like you are seeing them as the people that Caitlin was mentioning that they really are, right? And you're taking seriously your role as a constituent.
Great, thank you. Caitlin, did you have anything you wanted to add?
I second all of that. I think all of that is exactly what I would have said.
Wonderful. Yeah, it sounds like a lot of this is about getting those legislators to, when they hear the word sarcoidosis, right, to actually be able to picture different patients instead of just hearing the word, right? So with that in mind, for both of you, in your experience, what makes someone a powerful advocate?
Caitlin, jump in.
Yeah, I'll say the ability to share your story succinctly and tie it to a piece of legislation. So succinctly being able to say, this is my problem, this bill would be a solution. Will you please co-sponsor X, Y, and Z? And sharing a story that, is impactful, bringing photos with you, being organized, having one pagers on those bills when you go into meetings. But I think follow up also is so important, to maintain that relationship, because like you said, the more you put into that relationship, when you do show up for a meeting, they will recognize you. They'll know what you're there to talk about. They remember your story. So yeah, just sharing your story succinctly in a way that will connect your member with you, and then continuing to have communication with them.
And I would say, don't be afraid to be vulnerable either. One of the things that we like to do is, always put lipstick on top of everything to make it look perfect, right? And this is not that moment. This is a moment to be very candid and honest with your legislators, so they understand what those challenges are. And really make sure that they understand that there are significant barriers. Many times, rare disease advocates and sarcoidosis patients are the biggest warriors that you can imagine. We even use that word a lot of times in our community. They're very resilient and able to, move through whatever life is handing them or handing you. And that's great, but this is not that moment for you to share all of the ways that you have figured out how to cope. It's to share that there's all these things that you have to cope with. And it's really important to put that out there. And it's a hard thing to do. And this is where why advocates are such heroes to all of us when you're out there sharing those stories, because it's a very hard thing to do, to share that story. But it is really important to share the story in such a way that tells them and gives them something to understand on what are those challenges that you're constantly battling and fighting against. And then to Caitlin's point, don't leave it there. It's really important to make sure that they know how they can help. So what are those steps that they can take to help? But definitely being honest and open, and then moving into that, how you can help us is really key.
Great, thank you. And Tricia, this is a question for you. Can you speak a little bit more about that patient-focused drug development meeting that you mentioned and how people can get involved?
Yes, yeah, this is so exciting. Our patient-focused drug development meetings, just as a minute to take a moment back, the patient-focused drug development meeting was something that the FDA put in place a number of years ago in order to try to hear more directly, especially from the rare disease community, and understand what are those challenges. So essentially, drug development and finding a new therapy has a formula that is consistently used by the FDA. They're gathering data and they're moving through that process. And that works for really large diseases. That's been really effective in cancers and in heart disease and in diabetes. But it doesn't exactly work for a rare disease population, because what they're relying on is large numbers of participants. They're relying on participants that don't have any other comorbidities or any other illnesses that are coinciding with their sarcoidosis, for example, right? And so each step of the way, we need to really provide that education. And so we're encouraging each of you, you'll see the PFDD page there, to share a little bit about what you would want the FDA to know about your story. If you were to share anything about your story, what is it that you would want them to know that makes it a challenge for you with the current therapies you're taking, or why you wish there was another therapy? I'll give an example of something we know we're going to be talking about, which is fatigue. We know our community suffers with fatigue. Fatigue is really hard to measure in a sort of standard way, but that could be a really important topic, for example, for the FDA to know that we need new therapies that are addressing the barrier of fatigue for patients. So on that page, you'll see a form that you can fill out and share some of that information. We'll be sharing out with you a survey in a few months, as well as an opportunity for you to give feedback that will be helpful as we shape out the programming. And there may be opportunities for some of you to also share your story live. This will be a public event, so there'll be opportunities for people to call in or participate in polls. So there's many, many different ways to add your voice, but we encourage you to join us for this.
Great, thank you. And a final question for, I'll start with you, Tricia, but you can chime in too, Caitlin. How does FSR and EveryLife determine their legislative priorities?
Yeah, that's a great question. So in order to determine our legislative priorities, we really rely on you. So these legislative priorities that we have listed at the beginning, they come from the community. They come from hearing your stories, from those of you that send us emails to say, I'm really struggling because I was trying to get access to this medication, and no longer is that available to me. Or I can't figure out why I'm being denied for this drug, and I don't know what is happening there. And so we take all of those stories and all of that impact back from you, and then we work really in collaboration with the EveryLife Foundation and with other organizations, through our coalition work, to really make sure that our priorities are aligning with the needs and the concerns of our community. So these coalitions that we work with are all sitting down, and we're also sort of testing the wind a little bit to see what our legislators might be able to act on in that moment. So sometimes it's not the moment for that conversation because that isn't the way that the political winds are blowing. But for example, with like the Safe Step Act, there's been a lot of attention being given to that. So it's a really good time for us to chime in and say, yes, this impacts us as well. And maybe something else is put on the back burner at the moment from a legislative standpoint. And our job is to get some attention to it, but knowing we can emphasize some of the areas where we can make significant headway. The one thing to know that I think is really important here is, unfortunately, legislation, it's a slower game. It's not going to happen overnight. You're not going to make a legislative change, But if you're consistent and persistent, you can make those changes and you can move up topics. And so that's where we get our information from all of you, and then working alongside all of you to make sure that the legislators are hearing that. And Caitlin, I'll pass to you.
Yeah, thank you. We have a cohort of experienced rare disease advocates who have been in the space and are leaders in the space who sit on our RDLA advisory committee. So prior to any of our rare disease weeks or Rare Across America, we survey this advisory committee of patient advocates on what they and their communities feel the ask should be. And so we provide them with a document that has every rare disease bill we could think of, has the name of the bill, the number of co-sponsors, where the bill is in Congress right now, what committee it's in, all the information. And they go through and rank each of the bills, and those that are ranked the highest end up being our ask. But it's also important to note that when you are participating in our Hill meetings, you don't have to use our ask. If you're participating from another organization, like FSR, and you all have a bill that you are championing and that's what you want to talk about, then absolutely that can be your ask. You don't have to pick one of ours, but a lot of folks that participate with us aren't involved in another organization. And so we do like to have these asks for them to, have an easy selection when they go into meetings. And it provides us with the opportunity to really take deep dives into a couple of asks. So that's how ours are selected.
That's wonderful that there's so many resources for advocates out there. And I know that we mentioned earlier, it can be pretty intimidating, right, to get started. So it's great to hear that there's so many things that are already made for them that they can just go out and share with their legislators. And it's also great to hear that so much of these priorities really come from patient voices, right, and their experience and what's important to them. So unfortunately, we are reaching the end of our time, so we can't answer any more questions. But Trisha and Caitlin, did you have anything that you'd like to leave the audience with? Caitlin, I'll start with you.
Yeah, I just want to encourage everyone to be open to advocacy. I know it's scary and it can be intimidating, but everybody starts somewhere, and there are so many resources and trainings and all the programs to help you get started. There are so many people that would be willing to help get you started even. So don't let the intimidation scare you away from starting your advocacy journey and getting involved more.
Great. And I agree with what Caitlin's saying there. Get started. And for us, I think that the key part is really be comfortable sharing your voice. Get out there and let people know what your concerns are, whether that's reaching out to FSR so we know what your concerns are, or participating in the activities of our partners that are available, but really raising the voice on what those concerns are for our community. It's a version of saying sarcoidosis. As we wrap up our awareness month, saying sarcoidosis is not just saying the word, but really sharing what that impact is on your life so that people can really understand that and start to change what we're doing. So think of this as a way of extending our awareness month all the way through the rest of the year. Say sarcoidosis, get sarcoidosis out there, get people to understand the impact of sarcoidosis on your everyday life.
Great. Thank you, Trisha and Caitlin. I know that we threw a lot of resources and information at all of you, and there's been a couple of questions. So the recording of this webinar will be available after, and we'll send out an email about that, as well as an email with a lot of the resources that we mentioned, so you all can continue to take a look and explore what really speaks to you. So thank you. FSR would like to extend our sincerest gratitude to today's speakers. Thank you for sharing your experience, your knowledge, and your valuable time with us. And now I'll pass it over to Mary to close us out.
Thank you, Mia. As we reach the end of our really terrific webinar this evening, I want to thank Trisha and Caitlin for sharing their invaluable insights and how legislative and policy advocacy can raise awareness. Today, we explored the power of using advocacy to break the silence surrounding sarcoidosis and to educate others. and to work toward greater understanding and support. And we've learned by sharing our experience, we have the power to change the lives of those living with this disease and their loved ones. We're grateful to our speakers for sharing how we can best engage in advocacy efforts in a variety of ways, whether it's, as we heard, whether it's attending a conference, a special event, in person or virtual events, or just calling our legislators. We can all make a significant difference. As we learned from Caitlin this evening, EveryLife Foundation is doing extraordinary work, engaging patients from all over the nation, and we are grateful to partner with them and encourage you all to engage in many of the opportunities highlighted through EveryLife Foundation throughout this evening. And so many wonderful resources and tip sheets to help you along your advocacy journey. And as Tricia highlighted, FSR also has resources, including a wonderful comprehensive toolkit that we recommend that you utilize. It's there to support you in your efforts. And don't forget to circle back and watch the video that was shared earlier in the chat. I can say I've been advocating on Capitol Hill for many years, and there really, truly is nothing more stimulating than walking the halls of Congress and meeting with members of Congress who want to hear your stories. They want to hear from you, and they want to learn from your experiences and challenges so they can address legislative efforts. Building relationships, as was mentioned, with members of Congress is just so rewarding and so important in this process. So let's continue to use our voices, reach out, speak up, and share your story with your legislators and local government officials, and let them know why sarcoidosis matters, whether it's through, as I said, a letter or social media or in-person meetings. Each of us can make a difference and should make a difference for others living with sarcoidosis. Let's also leverage the power of community along this journey, connecting with other patients, caregivers, and advocates. Stay tuned to the advocacy efforts at FSR and seek out opportunities that we learned about again through Rare Across America and other initiatives. So thank you once again to Caitlin and to Tricia and to all of you for joining us today and taking the first step in engaging, perhaps for your first step, engaging in the legislative process and in advocacy. You are not alone in this journey. We are here to support you. As it was said earlier, there are so many resources, and if you ever have a question, just pick up the phone and call us. We'd be happy to walk you through anything that might help you in the process. So let's ignite change, inspire hope, and the journey towards greater awareness and support for sarcoidosis begins with each of us. Together, we have the power to continue saying sarcoidosis, as Tricia said, as we end Sarcoidosis Awareness Month, until it is understood and supported and ultimately overcome. Together, we are stronger, and together we can drive meaningful change. Let's remember to keep the momentum going, and the time is now for sarcoidosis. Thank you again for joining us, and we hope you have a wonderful evening. Thank you.